So you might be wondering, wait a minute, I have a chronic health condition and I don't have a history of childhood trauma. How did I get a chronic health condition? Well, you can get a chronic health condition, through genetics. There's a whole field called epigenetics, which is about the effect of trauma on preceding generations and how it can affect genetic transmission. So maybe somebody in your past had trauma that they dealt or that they were dealing with that affected their own genetics, and unfortunately, you've gotten the result of that. And what about if you have a chronic health condition and you know you have a history of trauma in childhood and your doctors never asked you about it? I think it's always good to do a little education and to say to physicians, hey, you know what? I've got a history of adverse childhood experiences, a lot of trauma in my childhood. For example, like grew up with an alcoholic father. I grew up with domestic violence. There was a lot of neglect in my household. What you can do is, again, share it with your physician. And you can ask for a referral to a mental health counselor in order to deal with that trauma. Now, if the doctor says, oh, there's no connection between the two, you can say, well, actually, there's this study that it pretty conclusively ties the two together. There's a wonderful book by Gabor Mate called When the Body Says No. And it talks about real life examples of this connection between the two. So if your doctor isn't informed about this, that is unfortunate, but know that you can get help for trauma yourself. If you can, research on the internet what therapists are available in your area. I think body-based therapies such as EMDR and somatic experiencing are the best ways to approach trauma that have the longest lasting results. So know that your life can be better regardless of what your doctor may or may not refer you to.